Hi everyone, John Herzenberg here, and what I'll be demonstrating today is a correction of this Equinus foot contracture using a Hexapod circular fixator. Why Equinus? Well, a normal Equinus may be 10, 15, 20 degrees. This one's 60 degrees. It's almost totally in line with the leg. Now how do we measure that? We'll measure from the plantar surface of the foot, so I'm measuring from the tuberosity of the calcaneus, the first metatarsal, relative to the tibial shaft, and I'm getting about a 60-degree Equinus. So that's a lot of correction, and you'll see as we continue on why that becomes important and what tricks I can share with you on how to get out of this very strange situation. This is a foot ring that's been closed off for additional stability, and our foot will fit within that. But as you'll see in a few minutes, when we put the wires in and put the rings on, it's more useful to mount the ring open, and once the ring is mounted, then we'll add the foot half ring to close it. I'm going to mount my wires on this foot so that they're parallel to this cutting board surface. And then once the wires are in, then we'll add the ring that goes with it. I'm going to turn the foot over so you can see it. I have a temporary wire here just holding the 60-degree Equinus for me. We'll start by locking the calcaneus with two counteropposed olive wires. One transverse olive wire will come from the lateral side perpendicular to the calcaneus. The other one will come from posteromedial obliquely, not quite at a 90-degree angle, but exiting before we reach the calcaneocuboid joint. I'll take another olive wire. I'm looking for that wire to be parallel to the plantar surface of the foot. The second olive wire will come from the medial side. And now the calcaneus is locked by counteropposed olive wires. I've now placed two counteropposed olive wires on the calcaneus, and I have my cutting board surface to demonstrate the flat surface of the foot, to show you that those wires are more or less parallel to the cutting board surface. And that's going to reflect where our ring is going to go. Next, I'm going to place a third wire from the fifth metatarsal to the first metatarsal that is perpendicular to the foot. And then I'll have good fixation of the forefoot and the hindfoot. This wire shoots uphill because there's a transverse metatarsal arch. So I want to start from the top of the fifth and aim for the bottom of the first. If I miss some of the middle ones, that's okay. And this wire ideally should be parallel, but sometimes it ends up being a little bit sloped upward because of the arch of the foot. The principle here is that you go from a small target to a big target. If I start my wire on the first metatarsal, I may or may not hit the fifth. If I start my wire on the fifth metatarsal, it's easier to hit that big target of the first metatarsal. I'm going to start my metatarsal wire in metatarsal number 5 and aim for the distal part of metatarsal number 1. I've just hit number 1. I went underneath number 3 and underneath number 2. That's okay because there is a transverse arch. It's important here to make sure you're not in the joint. We don't want an interarticular wire. I have my three basic wires, counteropposed olive wires in the heel and a smooth wire in the distal metatarsals. This is my foot ring, and I mentioned to you before that I don't like to construct the entire foot ring because it's hard to get it on over these wires. And I want this foot ring eventually to be parallel to the plantar surface of the foot. So a much easier technique is to take the open foot ring and then we'll add the 1/2 ring to close it after we slide this on. So with my rings in slightly different planes, I can try to find what is the best pathway by sliding it above, below, through this maze of wires and see where it fits the best. That looks pretty good. And where it fits the best is where it looks parallel to the plantar surface of the foot. So I'm going to go ahead and start putting my fixation on. Basically, I want to have the ring parallel to the plantar surface of the foot and also parallel to the long axis of the foot. So this wire is resting right on the ring. I'll fix that wire first, this wire second. This one's above a little bit, so I'll add a washer and so forth. I'm also paying attention to the holes that have the circles because that's where my struts are going to go. And I don't want to put a wire crossing a hole where I might need it for a strut. Now once I fix a wire here, I can no longer move it side to side. So I have to make sure I have it in the right position before I lock things down. So that wire rests exactly on the ring. This wire is going to rest on the ring. I can add one directly. This one's directly on the ring. For this one, I'll have to add some washers. At this point, I've attached the 3 wires to the frame. I haven't tensioned them yet. And I slid my ring in between the wires, threading in between or weaving in between so that the ring is now parallel to the plantar surface of the foot. In surgery, we sometimes have a surface, we call it a cutting board, that goes on the plantar surface of the foot. And the goal of that is to have that cutting board sitting on the plantar surface of the foot parallel to the ring. The next thing I'm going to do is attach the half ring. That will close the loop, make this a much more stable construct, and then I'll tension the wires. I'm tensioning the last of these 3 wires. And to create more safety in the operating room, I'm going to show you a technique for breaking these wires at the base of the wire fixation bolt. If you just bend them parallel to the surface of the ring, back and forth 4 or 5 times, the wire will break, and it will break very close to the wire fixation bolt so you don't have to worry about cutting yourself. I've completed the provisional fixation of the foot with the 2 calcaneal wires and the 1 metatarsal wire. Later, after we know where our struts are, we may add a wire in the midfoot and a wire in the neck of the talus to stabilize the foot as a unit in order to focus all the forces on the ankle joint, because that's where we want our distraction to take place, not in the subtalar joint or in the midfoot joints. But for now, I'm going to now direct my attention to the tibia. And I'll put a 2/3 ring on here, and normally this is put on perpendicular to each segment. So just like the foot ring is perpendicular to the foot segment, the tibial ring should be ideally perpendicular. But as you'll see in this construct, we're almost at 90-degree angles to each other, and that's biomechanically disadvantageous for the hexapod system. We'll get a stronger mechanical push if our rings are a little more parallel to each other at this point. That means that when we finish, they won't be parallel to each other. This one will be oblique. So rather than place this perpendicular to the tibia, I'm going to tilt it a little bit forward to give me a little bit more room to place my struts in the back and a little bit better mechanical advantage in pushing. For less severe cases of Equinus, I would feel very comfortable placing this ring perpendicular to the long axis of the tibia. But for this hyper Equinus case, I'm going to tilt it forward. So I've applied this proximal ring intentionally at an oblique angle to make my frame biomechanically more advantageous. Now we'll add an additional point of fixation on the tibia. So now we have stable fixation on both ends. At this point we can add our struts, and based on where our struts come out, we can decide where we're going to place additional fixation. We now have stable fixation in the tibia, stable fixation in the foot. So now we can add our struts in the hexapod configuration. And based on where our struts come out, we can decide where we want to add additional fixation to the foot and something also below the ring here. At this point, I've completed the application of the 6 hexapod struts to this frame. You notice by having this ring canted downward in the front and upward in the back, it gives us more leverage in the back for pushing the foot into dorsiflexion. Here we'll be pulling up into dorsiflexion, but here we're pushing down into dorsiflexion. Now you notice that the rings have circular holes where you're supposed to put the struts. And I've done it in the back struts and I've done it in these two. But here I've placed this strut in a non-standard configuration. And the software will allow you to enter that you've placed this strut and this strut in this non-standard configuration. Why did I do that? I want to pass another wire on the neck of the talus. And that wire on the neck of the talus is difficult to get past a strut if the strut is in the normal configuration through this hole. So this is just a little small trick that makes it a little bit easier for configuring wires in the neck of the talus for foot frames. I'm going to place one more wire, this one in the neck of the talus, and I can hook onto this wire by suspending a plate inside the ring. But I'm outside of the path of the struts. This wire may be a little bit difficult to connect to. We could use a post. That would work. Alternatively, we can build inside with a plate and up. So now we've completed the fixation. In situ fixation. We're not trying to correct the deformity acutely, just to match it. There's about a 60-degree Equinus. Fixation started off with the foot fixation first. 2 wires in the heel, 1 wire in the metatarsal. Later at the end, after I put my struts in, I added a tailor neck wire to focus the forces of correction on the ankle joint and not on the midfoot joints. If I turn the model over, you can see how I managed to connect the tailor neck wire to the ring by dropping these 2 plates inside the ring and then attaching on the inside. It can get quite crowded here, which is another reason why I decided to use the non-standard hole for fixation of this number 3 strut and on the other side the number 6 strut. Normally it would go in this hole, but I pushed it back to the 3rd hole behind, which is a legal hole, and the software will accommodate that as long as you tell that you did that. And that opens up this space for fixation of a tailor neck wire. Very useful for these complex foot deformities. In the tibia, I have a total of 3 points of fixation in a delta configuration, and they're all placed so they're not going to be in the way of the struts during correction. At this point, I'm going to make a notation of the strut lengths, sizes, and before we leave the operating room, we'll take an x-ray that shows the lateral view of the foot with the center lines. I don't know if you can see that here, the white lines, the center lines which denote the center of this ring, fixed with a marker so that we can gauge the mounting parameters for the foot. I've placed a long 30mm bolt at the center hole of this ring and one over here. When I go to take my x-rays, I'm going to line those 2 bolts up so that we get a gun sight view, and that represents the center of the ring and our mounting parameter, which in this case, since the center of the deformity is in the subtalar joint, our offsets are probably 0. On the AP view, our center of the ring is lined up with the center of the heel and the 3rd toe. So we have essentially no offsets for our mounting parameters on the AP view. We've completed the frame application and now we have to run the program. First, let's take a look at our preoperative x-rays. Sometimes it's easiest to do the measurements of the deformity on the pre-op x-rays without all the hardware in the way. So this is a foot Equinus problem, and the way we look at feet is we draw a line to represent the plantar surface of the foot. That's this yellow line drawn from the calcaneus to the first metatarsal. And then relative to that line, we draw a second line, the red line, perpendicular to it, and that line should pass through the lateral process of the talus. So that red line is the reference line for the foot, and we are going to use the foot as our reference. Now for the tibia, it's easy. We just draw a mid-diaphyseal line through the tibia, and the intersection between this reference line and the blue moving line is, in this case, we're going to call that the corresponding point. This is the apex equals corresponding point method. We can see that the intersection between these lines makes a 57-degree angle. So that's our deformity to correct. And by the way, that will take us to neutral, and then we'll do a residual program to get some additional dorsiflexion to prevent relapse. Now, if the apex of the deformity is the corresponding point, where's the origin? Well, by definition, the origin is on the reference line. And if we're going to try to lengthen this a little bit to disengage, then we want to move up with our cursor and place the origin about 1 centimeter or so above the corresponding point. So what we can think of as happening here is the yellow dot, which is the origin, is attached to the red line. The red dot is attached to the blue line. The yellow dot, along with the red line, is going to move down to the corresponding point, and then it will correct the 57-degree angle. So we'll have some distraction and angular correction. On the AP, there's really no deformity. It's a pure Equinus, so we don't really need to measure on the AP view. Now let's look at this x-ray that I took after the frame was applied. It mirrors the pre-op x-ray that we took before the frame was applied. So let's see what's going on here. When we put the ring on, we made efforts to make that ring parallel to the plantar surface of the foot. And if we were to draw a line from the calcaneus to the first metatarsal, this ring is pretty close to being parallel. Our reference line was perpendicular to that line of the calcaneus to first metatarsal. And then the blue line is the moving line. That is the mid-diaphyseal line. The intersection point is the corresponding point, because we're using apex equals corresponding point method. And the yellow dot is our origin. We're going to lengthen about 8 or 9 millimeters here. Now the computer wants to know a couple of things. It wants to know where is the center of the ring relative to the origin. And in this case, you can see on the bottom of the screen these two long bolts. I put those on the frame at the center of the ring marks, and so we're pretty close to having the center of the ring centered right on the reference line. The other thing it wants to know is how far is it from the center of the ring to the origin. So the length of this green double arrow line, which in this case is 37 millimeters, is the axial offset, and we'll put that in. Now, everything is made, all the measurements are made relative to the mag ball. You can see just above the toes there's a 2.54 centimeter mag ball, 1 inch mag ball. So our measurements can be quite accurate. So now let's take these measurements and go to the program and do our initial correction to bring this from hyperequinus to neutral. This is the first of 7 screens that we'll have to deal with. The first one asks for case info, the name of the patient, the date of the surgery, and you can add some case notes here. We choose what we're doing. We're working on the left foot and ankle, and we're using a long bone frame. This is not a miter butt or 6+6, but it's a long bone or ankle frame. Looks like a standard tibial construct. And then it asks us to choose the operating mode. 99% of the time we're using total residual. Occasionally you may want to pre-construct a frame, in which case you use the chronic mode. So we'll move on to the next screen, deformity. And here the computer is asking us to choose which is the reference segment. And since we chose the foot as the reference segment, we're doing a distal reference. Had we selected the tibia as our reference, we would say it's a proximal. The deformity measurements on the AP view, we decided that there was really nothing. On the lateral view, we measured a 57-degree Equinus or plantar flexion deformity. And I also would highly recommend that when you do these joint contractures that you build in some lengthening. So I'm going to call it 5 millimeters short, so we get 5 millimeters of distraction through the ankle. That's just to disengage the articular surfaces. And we're going to do that first. So there's a little button here that says apply axial translation first. And that allows us to first distract 5 millimeters and then do the 57-degree correction. So that's the deformity measurements. The next frame is the next panel that we have to look at is the frame parameters. And here we get to put in the size of the ring. So I've put in here that I used a 2/3 ring, 155 millimeter proximally, and a foot ring, 155 millimeter distally. The struts that we use were mostly longs, but number 4 and 5 were medium length struts. So we put that in as well. Now we'll go on to the next frame, which is the mounting parameters. And just before we get to that, I did use some custom strut mounts for this particular frame. Normally the two circled holes are the ones that we use, but in this case we moved the number 3 strut back and we moved the number 6 strut back so that we would get better clearance. And you have the option of telling the computer that you've done that, and that is found up here. On the distal ring, you see this little thing that says custom mount. So if I click that little radio button, it turns green. And then when that happens, I get this dialog box come up and I get the chance to say where I put the number 3 and number 6 strut. So the next panel that we have to deal with here is the mounting parameters. So this is basically telling the computer where we put this ring relative to the reference line. So we know on the AP view we centered it, so there's really no medial or lateral offsets. On the lateral view, we were about 11 millimeters anterior to the origin, and so here's my chance to tell the computer that. And we also said that we're 34 millimeters distal to the origin. In other words, the origin was above the ring by about 34 millimeters. The next panel is the strut settings, and this is the initial strut settings that we put in. So I enter all 6 of these settings, and then we'll hit this button, the calculate final settings, and the computer will chug along a little bit and then come up with our final strut settings over here. And this is our target goal. Now I'm showing here what the lateral view looks like before and after. And you'll notice that we did apply the ring obliquely on purpose, so that would be a less severe angle. And so that's why it's not perpendicular to the tibia. And this is at the end of our initial correction where we did a 57-degree correction from the Equinus to a neutral position. We'll see in a minute that we're going to want to overcorrect that, but this is okay for now. We'll go on to the next panel, which is the structure at risk. And what is the structure at risk? It's the anatomic structure, either bony or soft tissue, that you want to move the fastest. So in this case, it's on the concave side of the deformity, it would be the Achilles tendon. So here's our yellow dot to represent the Achilles tendon. And I estimate that it's about 55 millimeters posterior to the reference line, that red line, the origin line. Now, the next thing the computer wants to know is what our correction rate should be. Typically, that's 1 millimeter per day for either bone or soft tissue. In this case, I put in this extremely rapid rate of 7 millimeters per day. Why? I did that so that when I generate the schedule, it'll be a relatively short schedule, 9 days in this case, and it will fit on one screen. This is the final screen, which is the prescription, and this tells me the starting strut lengths, the ending strut lengths, and which struts have to be changed during the correction. You can dig a little deeper and find out down at the bottom here what the strut change on number 1 has to be from a long to a medium. The green strut number 4 goes from a medium to a long, and the blue strut will go from a medium to a long. So this is our schedule that we will print out and give to the patient. Again, I did a very condensed schedule here, very rapid, so that it fits on one slide. So now we're going to take these final numbers and the strut changes, and I'm going to go back to the Sawbones lab and apply these numbers and do these strut changes, and let's see what we get. I've just completed the correction based on the program, and if we look at the lateral view, we can see that we've corrected the foot to a neutral position, but that's not really good enough. We want to overcorrect it to beyond neutral. So what I'll do next is I'll run a secondary program, a residual program, and get the final correction where I get this 15 degrees turned up. If we stop here, even if we leave the frame on for 6 or 8 weeks, there's enough memory in the soft tissues behind the ankle that it will go back down into Equinus. So it's really important to overcorrect into dorsiflexion. So I'm going to go back to the computer, run a residual program, and tell it I want 15 degrees of dorsiflexion. So we had a nice correction to neutral, but I strongly recommend that you overcorrect. So we're going to do a total residual and get a second correction to bring it above neutral. So how do we do that? Well, the simplest way is to take our initial schedule. This is from our basic hyperequinus frame that we just did. We go to our patient schedule and we take the last day of the program, which is where we are now. And I've circled this little button that says total residual, or TR. So we hit that button, and instantly what the computer will do, it'll generate a second schedule for us, a total residual schedule. And it's going to take us back to the first panel of that schedule, of that program. It automatically labels this as second correction. It's the same initial name that we gave it, hyperequinus frame, but now it's the second correction. This is our total residual. And everything is pretty much the same as what we put in. But when we go to the deformity panel, it erases all of our deformities. And now I've put in the new deformity, which is 15 degrees of Equinus or plantar flexion. And we'll give it a couple millimeters of lengthening. We'll call it short. So we'll lengthen 2 millimeters just to make sure we disengage that articular surface. So it wiped out the initial deformity measurements, which was the 57 degrees of plantar flexion, and it replaced it with 0, and I went in and entered 15 degrees. Why? Because I'd like to see 15 degrees above neutral. So when it draws the image for us, it draws this foot in 15 degrees of Equinus, although we know the foot is actually in a neutral position, but you have to kind of fool the program by doing this little maneuver. Okay, we'll go on to the next panel, which is the frame. And you know, we did a few strut changes, and the computers recognized the fact that we did those strut changes, and so it automatically populates this spreadsheet with the new struts that we put in. The rings are the same, the custom mounting is the same, so none of that changes. We'll go to the next panel, the mounting parameters. And since we really didn't move anything, the ring stays where it was. There's no changes in the mounting parameters. The computer automatically recreates the original mounting parameters that we had. So we can go to the next one, which is the strut settings. And the computer automatically populated the initial strut settings here with what was really our final strut settings from the initial program. And then when we hit calculate final settings, it'll generate the new final settings. So this is the old final settings, and this is the new final settings. And we'll see what's happening here is our depiction of the model will go from 15 degrees of Equinus to a neutral position. In fact, what's happening is it's going from a neutral position to 15 degrees of dorsiflexion. You have to trick the program though, so little fine detail here. So now we'll go on to the structure at risk. And our structure at risk doesn't change. It's still the Achilles tendon, and it's still 55 millimeters behind the reference line, the origin line. And in this case, I've said let's go at 2 millimeters a day, and that'll give us a 9-day program, which should fit easily on one slide. In reality, I would do this at 1 millimeter per day, but just for illustration purposes, when I go to the next slide, now we see that the entire schedule will fit on one page. And that's just kind of nice for demonstration purposes, but it is a rather fast correction. So in reality, we would go 1 millimeter a day, not 2 millimeters per day. And so this is our where we are right now. This is our new final strut settings. So what I'd like to do now is go back up to the Sawbones laboratory, and we'll enter the new data here, the new numbers. Note, however, that there's no strut changes, so we don't have to go through that. We use the same struts, and let's go back upstairs to the lab and see what our final frame is going to look like after we do this additional 15 degrees of dorsiflexion above neutral. I've just completed the residual program in order to gain additional dorsiflexion beyond neutral. And so now if you look at the angle between the tibia and the plantar surface of the foot, we're at about 15 degrees of dorsiflexion. So that's the end of the program. And just want to point out one more thing, that when you do hyperequinus corrections, it's not a bad idea. I didn't do it for this exercise, but it's not a bad idea to insert pins in each of the toes, because as you go from a hyperequinus position to a dorsiflex position, the toes get very tight. That's very easy to do just by drilling longitudinal pins at the end of the case and incorporating those pins with a wire fixation bolt into the front of this foot ring. And that concludes the hyperequinus exercise for this Hexapod fixator. Thank you.